Oh, I see.
I was over there before I came over.
Okay.
All right, welcome everybody. We're gonna go ahead and start getting rolling on our Wolverine Caucus for today. So my name is Sean Hammond. I am the Associate Director for State Relations for the Office of Vice President Government Relations at University of Michigan. And this is today's Wolverine Caucus. Today we have a few of our research experts introducing the first Michigan poll on healthy aging as a kind of following our work on the national poll of healthy aging, some really deep dives into Michigan specific, what's going on in our state. So we're going to go ahead and get started. I'm going to do some brief introductions. So first is Neil Hajra is going to make some opening remarks. He is the CEO of the Michigan Health Endowment Fund. And then following Neil will be Jeff Colgren, the Director of the National Poll on Healthy Aging, and Erica Solway, the Deputy Director of the National Poll on Healthy Aging, to give a little bit of background on what's going on in Michigan. Bear with me as I start the slideshow here.
Great. Thanks, Sean, and thanks to the virtual and especially in-person attendees. We appreciate it. My name's Neil. As Sean said, I'm the CEO of the Michigan Health Endowment Fund. Also a Wolverine, as was my father and as is my daughter. So really cool to be here with the Wolverine Caucus. I do want to acknowledge Dr. Jeff Colgren and Dr. Erica Solway because of the terrific work that they're doing, both with the national poll on healthy aging, but we're really excited about the Michigan poll on healthy aging, which they're going to talk about more. Very briefly about the Michigan Health Endowment Fund. We are the largest health foundation in the state of Michigan. We grant out about $35 million a year, give or take, and about $7 million of that is directed towards healthy aging. We take a lot of pride in working at all levels and partnering very deeply locally with communities, regionally, as well as statewide. We do a lot of collaboration with state agencies. Actually, I think that's what sets us apart from a lot of the other foundations in Michigan, is that we are an independent foundation, but the level of collaboration we have with state agencies and the public sector is very deep. And I think enhances our impact as a philanthropy and also encourages really innovative and great work at the state level too. So in our work and in philanthropy more generally, there's a lot of discussion about doing a better job of centering the voices of those that we're purporting to serve, elevating those voices and listening and recognizing that expertise is shared. And those that we are trying to uplift also have deep expertises that can benefit all of us in our work. And so that's why we're so lucky to have in the state of Michigan such a well-respected national poll on healthy aging hosted by the Institute on Healthcare Policy and Innovation at the University of Michigan. We're really appreciative to AARP and Michigan Medicine. They've been the sponsors of the national poll since its inception in 2017. And we're able to leverage that at the Michigan Health Endowment Fund because what we realized is, wouldn't it be great? We love the national poll. We use it in our work. Wouldn't it be great to have those insights at the state level as well? And that's where we got talking with IHPI, and that's where the Michigan poll on healthy aging was born. And so we're already learning a lot of valuable information from the poll. Some results published just earlier this month observed that nationally, a lot of older adults don't actually leverage all of the resources that we're trying to make available to them. So that question of if you build it, will they come? The answer is not without some kind of bridging and guidance, better communication. We're finding with the Michigan poll that we're doing a little bit better than the national trends on the awareness of resources, but we're also finding there's a lot of work left to do. And so as we think about our journey at the Michigan Health Endowment Fund about helping every older adult in the state have a better quality of life and age with grace and dignity, we need to do more in listening to these voices telling us folks don't know necessarily where to go. And even all these great federal resources through the Older Americans Act and area agencies and PACE programs and Medicare and Medicaid, we can invest in the promulgation of those, but we have to build those bridges so that there's awareness, not just by older adults, but obviously by their families, who are so important in this equation as well. With that, I want to just turn it over to Dr. Jeff Kulgren to really start diving deeper into the Michigan Poll on Healthy Aging. And thanks again to everyone for attending.
Well, thank you very much, Neil, for that introduction. Thank you to you and your team, Phil, who's here, Carrie, who's hopefully joining virtually, I imagine. We share your enthusiasm for introducing the Michigan Poll on Healthy Aging. We particularly appreciate the opportunity to present this work in the context of the Wolverine Caucus. Eric and I will be going back and forth, sharing our slides and talking about what we do and why, and then hopefully hearing from you your ideas about how we can better hear from older adults in the state of Michigan, and then ultimately translate some of those insights into changes in policy and practice to advance healthy aging in the state of Michigan. So I'm going to kind of provide a bit of a level set here where I take us back to the inception of the Michigan Poll on Healthy Aging, which Neil alluded to a bit. Really, this work began with the initiation of the National Poll on Healthy Aging in 2017. That is work that is jointly sponsored by AARP and Michigan Medicine. And really, the Michigan Poll on Healthy Aging builds on the framework that the National Poll on Healthy Aging has provided over its first 7 years. So the goals of the National Poll on Healthy Aging are, first, to develop, implement, and sustain a recurring nationally representative household survey of U.S. adults age 50 and older. Second, to disseminate those results through multiple channels, which you'll hear more about in just a moment. And then third, to reach a variety of audiences, including older adults, their families, healthcare and aging professionals, and policymakers. So what you can see here on this slide is but a smattering of some of the topics that we have covered in the National Poll on Healthy Aging in recent years. We actually, in drafting our slide deck, I think put all of our topics on one slide, and it was overwhelming, which illustrates just how much ground we have covered in the National Poll on Healthy Aging. So this is but a selection of some of the broad range of topics that we have covered. I'll highlight, for example, some of the work recently that we've done related to aging in place, a critically important topic in our state and in our nation. Loneliness among older adults, again, a critically important topic related to healthy aging. How we deploy technology to better care for older adults through use of things like patient portals, caregiving, health behaviors, addictive eating, advanced care planning. There's so many critically important topics to better understand older adults' experiences and how we can better support them and their families to achieve health goals. This work has been widely covered, both in the national media and increasingly in the international media as well. And so you can see here, but some of the major media outlets that have covered our work, I think most recently our work has been covered in the Washington Post. We've been covered a number of times in the New York Times, certainly in our more local media, Detroit Free Press, but you can see here the Guardian. So, you know, we have had our work covered both nationally and internationally in media outlets that all of us know about, but most importantly, that older adults regularly consume. So as we have been covering a broad range of topics in the National Poll on Healthy Aging, increasingly we were asked, well, what about in the state of Michigan? What does this look like for Michiganders? And so we said, well, gosh, that is such an important question. And that really was the genesis for the Michigan Poll on Healthy Aging and this fantastic partnership that we have been fortunate to form with the Michigan Health Endowment Fund. So Erica's now going to talk a little bit more about how that partnership started, some of the foundational work that we did, and then we'll get into some of the early insights from the Michigan Poll on Healthy Aging.
So I'm very excited to share what we've been doing as part of this partnership with the Michigan Health Endowment Fund, which started in March of 2020. 2023. So we're just over a year into our partnership, and it's just been really wonderful, both to have the expertise of the Health Fund and also to use additional resources to be able to really understand the perspectives of older adults in our state and how they might be similar or different to those we're seeing nationally. So during our planning period, which was last year, we conducted 6 focus groups with over 50 older adults around the state to hear directly from older adults themselves about what topics they were interested in, to hear about their perspectives related to healthy aging, how we might be able to tap into some of those perspectives in the development of new survey items that we could then use through our poll. We also developed a plan for how we would approach developing a robust Michigan sample. So we really wanted to make sure that we had enough people who were participating in our survey to be able to give us some really insightful findings. And we developed our first Michigan focused report, which was on scams. And we'll talk a little bit about the results of that report in just a moment. But we released that in November 2023, and it gave us an opportunity to think about how would we approach looking at the comparison of our Michigan results to what we're seeing nationally. And we were really excited just last month in May of 2024 when we were able to officially launch the Michigan poll on healthy aging. This was a really exciting development for us after many months of planning. Our Michigan reports are being released at the same time as our national reports. So for those who followed us and receive our emails, with the announcement of new reports. Moving forward, those will include both national and Michigan results. And they then include also a comparison between the two. And we're hoping that future polls may also include Michigan-specific questions, and we'll develop formats for being able to share the results of those. So I wanted to share from our focus groups some of what we heard about people's views related to healthy aging. So one of the quotes that was shared was, healthy aging means being able to function at my age and beyond with health issues, being able to live independently and in my own home for as long as. Another person said, I haven't heard of it, healthy aging, hadn't really thought about it until 2 years ago when I had my heart attack, right? So it's something that people are not necessarily thinking about until all of a sudden they experience a change in their health status. I want to know how to get to be one of those centenarians. I'm trying really hard to do the right things, and I want to know more about how to do that, right? So people want more, they want more information, and they don't necessarily know how to get it. And this fourth quote, intellectually, I knew all about aging until I got there. When it became personal, it was quite different than I thought it was going to be. So these just shed light on what we're hoping to be able to address through the Michigan Poll on Healthy Aging, which is really to help people get the information that can help serve them in terms of promoting their overall health and well-being as they grow older. So our Michigan poll on healthy aging methods are quite similar to those of our national poll, but I wanted to just highlight how we're approaching getting feedback from older adults here in our state. So our surveys, just like for our national poll, are conducted using NORC's AmeriSpeak panel. This is NORC out of the University of Chicago, runs a very well-respected panel. This is we use it for our national poll. It's nationally representative. In this case, it's representative of Michigan. We're also supplementing that with non-probability panels to make sure we have a sample size that's robust enough to be able to look at in-state differences, even looking at regional differences, we'll talk more about. We field our surveys approximately 2 times a year to a sample of about 1,000 adults aged 50 and older in our state. One of the new developments that we're really excited about is starting with our last poll, we were actually able to increase our age cutoff. So rather than going to 80, as we've done in the past, we are going as high to older respondents. We had someone in our national poll who was 101. And in our Michigan poll, that was, I think our oldest respondent was 94. The surveys are completed online or by phone. And the sample is weighted to reflect the state's older population. So I'm going to pass it back over to Jeff, who's going to share some of our early findings with you.
Thank you, Erica. And so now we're going to lay out some examples of some of our more recent findings in the Michigan Poll on Healthy Aging. And oftentimes when we're collecting our data, having both the National Poll on Healthy Aging and the Michigan Poll on Healthy Aging allows us to make comparisons to how we're doing in comparison to the rest of the nation. perhaps in the question and answer session, we'll get a little bit into how we came up with the topics that we do. I would say about that we are we have a large poll team that runs the national and the Michigan polls on healthy aging. We have parents, we have grandparents. Some of us are clinicians. I'm a physician. I care for older veterans at the VA Ann Arbor healthcare system. So I have my own experiences with issues that affect the health and well-being of my patients. We keep our eyes on the literature, on what's going on in the policy landscape, what's going on in the national media. Where is our comparative advantage for what is unknown about a particular issue and how we can contribute to public discourse around these debates? And we saw an opportunity to focus on scams among older adults. That is something for any of you that have a personal experience within your family about scams. It's a tragedy every single time it happens. We know that older adults, unfortunately, are targeted all too frequently by people who are attempting to defraud them of money. This is an issue that was personal for me, something my mom befell victim to a scam when she was still alive, and it caused her extraordinary distress and anxiety. And so often the issues that we choose to pursue in the poll are born out of our own experiences as well as what's going on in the state and beyond. Okay, so scams is a good example of that. So one thing that we asked about in our national poll on healthy aging is how often scam attempts happen. How often do older adults report that, yeah, somebody tried to scam me? And the way that we define that is having your credit card or bank account compromised, other accounts hacked, having lost money, or having your identity stolen. So 75% of older adults across the nation, and that just the past 2 years, so this is not even ever, this is just the last 2 years, reported that there was a scam attempt that they experienced either online or by phone, text, email, or mail, because we know that these scam attempts can happen through a variety of different channels. As we're increasingly online, that creates more opportunities for people looking to do bad things. And 30% of individuals reported experiencing actual fraud. So not just an attempt they'd experienced, but they actually lost money because of that. So this is a tremendously common experience, unfortunately. When we look at the state of Michigan, so this is now from the Michigan poll on healthy aging, we unfortunately see similar numbers within our own state. So 69% of older Michiganders reported a scam attempt, and 31% of older Michiganders reported actually experiencing fraud. So in some ways, we look very similar in this respect to the rest of the nation. It's an issue that affects all too many older Michiganders. One unique thing that we are able to do in both the Michigan and the National Poll on Healthy Aging is look at how these kinds of experiences relate to health and well-being. Okay, there's a variety of other consumer and social surveys that are out there. Our comparative advantage is looking at what about for people with particular health issues and these experiences, what health impact might experiencing different things have on older adults. And so our scam report is a good example of that. We found, as I just noted, a slightly higher proportion of Michigan older adults reported actually experiencing fraud compared to the rest of the nation. One critically important finding that we have from this poll is that those who reported having disabilities or lower household incomes more frequently reported experiencing fraud related to a scam. I think that should all give us a lot of pause, right? If we can imagine, whether it's in our own lives, people you know, maybe a grandparent, maybe your neighbor, somebody who struggles with a disability, whether it's a mental disability, a physical disability, and they are older, and imagine as well they're living on a fixed income. When those individuals are more likely to report experiencing fraud related to a scam, this is a major problem in our state and in the nation more broadly. And so, this is, I think, one of the most important findings that came out of that poll that we want to elevate within our state media, the national media, to policymakers in Lansing and beyond as an issue that we need to continue work to do better at as a society and as a state. Importantly, though, we found that those who were familiar with community resources for older adults were more likely to be very confident in spotting a scam. So fortunately, we shouldn't rely, of course, exclusively on this, but there are a variety of things that older adults can be aware of when individuals are trying to scam them out of their own money, right? How do you spot a scam? What do those scam attempts look like? There are a variety of organizations in our state and across the nation that do a lot of really fantastic work to try to educate older adults about how you spot a scam and how you can ward one off. Okay, so those who are more familiar with those kinds of community resources were more likely to report, yes, I'm very confident that I can spot one and avoid it. And so there are some opportunities here. I think it's not all doom and gloom. It is a major problem that we need to do better at, but some of these agencies, I think the work that they're doing highlights some of the things that we can build on to try to do even better. Views on scams among older Michiganders, again, zeroing in on that. Unfortunately, the vast majority of older Michiganders express some uncertainty about their ability to spot a scam. So again, in spite of the great work being done by a lot of community organizations and a lot of both public and private stakeholders, that there still is a lot of uncertainty about how you can spot a scam. So again, that's an opportunity here for us to do better. And I know that, we are, of course, entering state and federal election season here. We're even well in it, of course, in a lot of ways. The vast majority of older adults agreed that policymakers need to do more to protect people from scams. So this was across the board. Okay, so that was our very first report, and that one was kind of a soft launch that we did in November of 2023. That work, as we'll talk about in a little bit later, was picked up in our both media within Southeast Michigan and some of our statewide media. But we wanted to get some experience, including with our colleagues at the Michigan Health Endowment Fund, about how we get the word out and what we can build on there. Our second report, which was released in our May and June report, just very recently, a few weeks ago, focused on the top health-related concerns of both U.S. adults age 50 and older and Michigan adults age 50 and older. So we did this both within the framework of the National Poll on Healthy Aging and the Michigan Poll on Healthy Aging. This is work that was led by John Ianian, who I believe is online. He's our director of the Institute for Healthcare Policy and Innovation at the University of Michigan, and did a phenomenal job leading this module in partnership with our poll team. What you can see here are the top percentages of health concerns for which U.S. adults age 50 and older said they were very concerned for older adults in their community. Okay, so I'll give you a moment just to review what you see here on the screen. And I think you will see some common themes as we look at what bubbled to the top. Costs of medical care, costs of home care, assisted living, or nursing home care, costs of prescription medications. Do you see a theme here? Okay. Financial scams and fraud, also a cost-related thing. And then cost of health insurance and Medicare. Okay, so the majority of older adults across the nation said they were very concerned about these topics for older adults in their community. And this happened much more frequently than some of the other health concerns. You can see here in the poll, we listed 26 health-related topics within our poll. This is something that was done through what we often describe as a sister poll at the University of Michigan, and that's the CS Mott Children's Poll that preceded and created also a framework for our National Poll on Healthy Aging. This is a child's health focus poll run out of the CS Mott Children's Hospital for a number of years, where they did something very similar about what are the top health concerns of parents for their children. Okay, so we built on that framework and focus here on the top health concerns for older adults. Now, when we look at the state of Michigan, you will notice, and I'm just going to flip back here, it's almost exactly the same. Okay, so in the state of Michigan, Michigan adults age 50 and older, the top concerns are costs of medical care, costs of home care, assisted living or nursing home care, costs of prescription medications. Again, you see and hear a theme here. Financial scams and fraud, and the cost of health insurance and Medicare is also our top concerns of older Michiganders. And so this is a prime example of findings that we want to get out into the media, that we want to get out to policymakers in the state of Michigan, again, especially as we're entering our state election cycles, so that they understand what are some of the top concerns of older adults. I think Neil mentioned this very well at the outset. We're trying here to elevate the voices of older adults in the state of Michigan. And this is a really prime example of that. Now, one very unique thing that we're able to do in the Michigan poll is, yes, we are able to compare Michigan to the rest of the nation. But we're also able to zoom in on particular subgroups, because you can imagine these concerns that we're looking at averages across the state of Michigan. If we think about different parts of our state, we think about different populations within our state. They may have different concerns, and it's very important in the spirit of elevating voices of all older Michiganders that we recognize the diversity of our state and the diversity of experiences and perspectives, and that we're able to elevate all of those voices so that our policymakers and our media can understand what are some of the top health concerns of older Michiganders, and everybody has a voice. So, for example, we are able to look at gender differences in concerns. And one thing, for example, that we found is that older women in Michigan were more likely than men to be very concerned about a broad range of topics, including the ones that I just showed you on the screen. One example of something I think very interesting and important that we hope would be very useful for our media and for our policymakers in the state, especially our elected representatives who are from different parts of the state, are able to zero in on the different regions and what are the concerns of older adults within the part of the state that they come from. And concern about pollution is a great example. Okay, so that was but one of the many 26 concerns that we listed within our survey. And what we found is that older adults in Southeast Michigan were more likely to be very concerned about health risks from pollution. And you can see here the variation there across our state, ranging from 25% in Southeast Michigan all the way down to 11% in Northern Michigan. I could show you for the rest of the afternoon slides where we can do similar sorts of things for other top health concerns, whether they be related to costs, safety, quality of medical care, pollution, a wide number of issues. And we'll talk about, I think, a little bit later about some of the unique resources that we have on our website for the Michigan Poll on Healthy Aging, where you can go online and you can actually drill down through a Tableau dashboard, looking at different survey findings, and you can look at how they vary across regions for the state and different subgroups of individuals across the state. So we hope that that's going to be a very useful tool for our media, for our policymakers, and for the public. All right, so I'm going to turn it over to Erica to present some of the most recent findings from the Michigan Poll on Healthy Aging.
Thanks, Jeff. So I'm very excited to share some of our most recent findings, which were just released a couple weeks ago. We released these in the in the format of what we refer to as a poll extra, which is more of an article style report, which allows us to be able to be very nimble and timely in reporting out findings that we think have unique relevance at that point in time. We recognize that there have been negotiations around Older Americans Act funding, that there's lots of conversations happening within our state related to funding for aging services. And we really wanted to better understand older adults' familiarity with services designed for them. And we specifically asked about familiarity and use related to area agencies on aging, which I'm sure many people in this room and online are familiar with. These are the organizations across our state and across the country that are intended to be a one-stop kind of shop for older adults seeking services in their community. We also asked about familiarity and use with the State Health Insurance Assistance Program, SHIPS, and wanted to understand, again, this is a program that exists to help people navigate decisions around Medicare, a very, very valuable program for many people, and wanted to know how much people were familiar with them and used those services. We also asked about long-term services and supports and whether people were familiar with their options for long-term services and supports should they need them. Again, something that we think people should be thinking about, should know about, and recognize that there might be a gap there. So as you can see from this slide, what we found based on our national survey of adults age 50 and older, just 7% said they were familiar and had used an area agency on aging, or AAA. 26% were familiar but had not used one. So at least they were aware that AAAs exist and would potentially tap into one should they need those types of services for themselves or for a member of their family. But 67% were not familiar at all. So 2/3 of older adults nationally didn't have any awareness that area agencies on aging exist. And when we look at this at SHIPS, State Health Insurance Assistance Program, the numbers are quite similar. Very small percentage report being familiar and having used a SHIP, 21% familiar but have not used, and then 3/4 say that they're not familiar with this program at all. And when we look at our state, there's a little bit of a positive news here. And we found that there was more familiarity with area agencies on aging. If you look here, it's 38% versus the 26%. And same with SHIPs, 27% were familiar but had not used here in our state versus the 21% nationally. But unfortunately, the percentages that are familiar and have used were relatively the same. And so we have fewer people in our state reporting being not familiar with these services, but still it shows that we have a lot of room for improvement. Over half of people in our state don't know about area agencies on aging, and 68% are not familiar with SHIP. And what's, one of the things that people may be asking is, is this different for people 65 and older? Many of these programs, are intended for people, older than 50. And we know many people 50 in the 50 to 64 age range are, maybe they themselves have disabilities or are caring for family members or friends who are 65 or older, people with disabilities. But even among those 65 and older, familiarity with these services was low. Really showing that there's more that we can be doing to be promoting the availability of these services and understanding of when and how they can be used. Kind of bridging that gap as Neil was describing. And when we looked at familiarity with long-term services and supports and those options, we found that that familiarity was even lower there. So again, much room for improvement. 88% of older adults said they knew very little or nothing about their options for long-term services and supports should they need them. So just a little bit more here, just to reiterate what I've already said. Older adults in Michigan were more familiar with AAAs and SHIPs than their peers nationally, though the proportion that used them was quite similar. And even among those age 65 and older, use was still low. And only 3% reported knowing a lot about their options for long-term services and supports. So we're really grateful to our colleagues at the Michigan Department of Health and Human Services who helped us think about these questions. We recognize in our state there's a lot that's happening to try and promote use of these services. And we're grateful that we can use the poll, we can tap into the poll as a mechanism for better understanding what people in our state know and don't know, and then potentially use that to build campaigns, education campaigns, awareness campaigns that might help shed light on the availability of these services here in our state and nationally as well. So I wanted to take a step and a moment here to just talk about what we've done and where we hope to go in the future. We're still quite new. We're really excited to be here announcing the Michigan Poll on Healthy Aging, recognizing that we already have ambitious plans for these next few months, but we're grateful, truly grateful for the partnership with the Michigan Health Endowment Fund and how it set the stage for what we think will be a really robust ongoing poll that will shed light, hopefully for years to come. But in this first year or so, we've been doing a lot to set the groundwork for our future work. So as Jeff shared, we through our top 10 report where he shared the results, we used Tableau to share our Michigan poll data. So one of the things that we do with our national poll is after a period of about 18 to 24 months, we make our data publicly available for free public use. And it's something that we really think is important to get the data out there to be able to make sure that other researchers can use those data. We publish papers and peer-reviewed publications based on them. But we recognize that the need to share the data from our Michigan poll is even greater, right? We want to be able to share this as soon as possible with the appropriate stakeholders, with really anyone who's interested in understanding more about what's happening in our state. So the Tableau dashboard that Jeff mentioned is something that allows us to do that. So moving forward, our hope is that we'll be continuing to use that to be able to allow people to look at subgroup differences, as Jeff was saying, to be able to kind of really dig into these data in a way that's usable for them. We are also doing as much as we can to spread the word through the Michigan Aging Network about the Michigan Poll on Healthy Aging. We have spent the last several years with our national poll really tapping into the Aging Network nationally to make sure they're aware of the National Poll on Healthy Aging and to share our findings. And we're hoping to do the same with the Michigan Poll. So we announced the poll launch at the Older Michiganians Day on May 1st. Carrie Cedarberg was there and shared that we were announcing, that this new poll was going to exist. Our first report was released the following day. We were grateful for the opportunity to be able to share that it was coming with such an amazing audience, and we're just hoping to continue to spread the word. So we welcome you to join our email list, to reach out to us. We want to hear from people, and we want to make sure that people are getting the information they need from this new Michigan poll. Another thing we're doing is that we're sharing our video clips featuring the poll results with local news media. So this is a really neat opportunity we have through our partners with Michigan Medicine Communications. We have the chance to do video interviews where we share poll findings. Jeff has been featured in several of them. And then the communications team actually creates clips that they share with local news media that they can then repackage those clips into their own segment that they can air on local news. And we found, Jeff has examples where patients have seen these video clips and have reported back to him, seeing him on the local news. It's a way that we really are getting out to older adults themselves directly. And we hope to do this more and more. Again, we recognize that we want to be in the media, in those places where older adults are, where they're getting their information. So as we think about our next steps, we are always considering topics, any topics for our national poll, for our Michigan poll, and would love to hear specifically any topics that we think might be of unique interest here in Michigan. So please share your ideas with us. We welcome them at any time. We're also hoping to engage older adult advisors to help guide our work moving forward, both in terms of topic ideas, question development, run ideas for wording of questions by older adult colleagues, people that we can reach out to on a regular basis to get their feedback. And so we're looking forward to developing that forward. And then we want to be, and we are obviously here today in Lansing, but presenting findings in the state. We welcome opportunities to share this work with anyone who would be interested in hearing more. We recognize that we're just at the beginning here. We'll have lots more findings to share in the months and years to come. So we welcome opportunities at any time, and we're happy to dig deeper if there are questions that people have that aren't covered in our reports, because often we have more to share than we have space in our reports to do that. So I just wanted to share, Jeff shared that slide with some of our national media. This is some examples of the local media that have covered our poll findings. These video clips, as one example, actually reached the Midwest. So there are other states similar to Michigan who are excited about this as well. And we're eager to see this grow with time, but grateful for the support and the interest in our local news media, because we do think this is a terrific way to get the word out. I wanted to kind of end and transition to our question and answer period by sharing our website. So our national poll website is healthyagingpoll.org. And then if you go to the Michigan, the /Michigan, you can go directly to our Michigan find. We want to hear from you related to topic ideas, opportunities to present, to share this work in whatever format would be useful to you. Our email address is healthyaging@umich.edu. And we've also included a QR code where you can sign up to receive our poll reports by email. We do that as they come out, so about 8 to 10 times per year. And from there, I'll transition to Sean, who will provide us with a few questions.
All right, big thank you to all of our speakers today. We appreciate it, and please keep the questions coming in. If you have them through Zoom, we'll be taking both kind of live and in person. We did gather some questions beforehand. I also just want to give a special thank you, Representative Aaron Burns, Representative Jen Conlon, who joined us today. So thank you for coming out to the caucus. So one of the first ones, and this really that came in before the talk, and I think it really fits in well, is with the discussion on scams and the concerns there, is how important is developing and sustaining digital literacy in pursuit of healthy aging?
Yeah, maybe I'll respond to that first, and then Erica, feel free to add. I think it's very important now. It is increasingly important, probably with every week that goes by. if we all think back to certainly 10 years ago, we didn't all have these, right? We've actually in the National Poll on Healthy Aging that we've looked as well at rates of enrollment in and use of patient portals. Many of you probably have portals that you use to communicate with your healthcare team. Those have become a ubiquitous part of healthcare delivery. Telehealth, right? Being able to do a video appointment with your doctor when you need something urgently. There are just so many ways related to health and healthcare that we're asking older adults to be comfortable with and familiar with technology. That creates a lot of opportunities. That creates a lot of challenges too. It also bumps up right against, issues of disparities, right? And access to technology, familiarity with technology, and all of that. So it's an opportunity, but a unique challenge too. That is something, however, that I think can be taught. There are strategies where we can say, how do we expand access to technology? How do we expand familiarity with technology? Similar to, some of the work being done at the local level. Now, how do you get people to spot scams? How do you know that you might be, getting scammed when somebody reaches out to you? Similarly, people can be taught for, how can you better use your smartphone for healthcare? How do you get more familiar with that technology, especially if you don't have a caregiver or somebody who can help you with some of those things? So yeah, it's increasingly important and something that fortunately, I think that resources can support. What would you add to that, Erica?
I would just say one of the strengths of our poll in its current format is that it's offered both, respondents complete it online and by phone.
Yeah.
Because we recognize that some older adults are not using technology and they may be encouraged to do so in the ways that Jeff described, but many people are not using it yet. And so being able to understand if people are choosing to complete the survey by phone, and that's their preferred mode of communication, where are they getting their information? And how can we make sure that those sources of information are also accurate? And so I think we appreciate that we're able to tap into the perspectives of older adults who are not yet using these forms of technology as well.
Thank you.
We were just saying, reference myself, that the platforms are actually, my 91-year-old mother lives with me and doesn't do technology, so I do it all. Like, I have to get her telemedicine going and her platform and move her around between the platforms. And it isn't really that intuitive, even for me. I mean, because sometimes it's like where you leave a message is where, and also getting your test results before they phone you, like that should be worked out, because you start to look at your test results and you freak out. But anyway, I'm sure that there are ways that it'll improve over time. But yeah, it's like my mother wrote the IRS a letter last night, and I'm like, really? This is not where we are. Like, go on the portal if you have a question about your taxes.
And actually I think that actually kind of flows into another question pretty well here is, for this round of polling, was there any digging in on caregivers, or is that something you're looking at for the next round? We had a couple questions kind of looking at that future of caregivers and what the importance and how things are going for our older adults with that.
Yeah, do you want to take that one? Erica?
Sure, yeah, we've been including a question asking people about whether they're a caregiver over the last few waves of our national poll, and we're doing that for the Michigan poll as well. We recognize that caregivers are obviously in a unique position, both that they're providing sometimes critical help to an older adult, but also that caregivers, are navigating these resources and may ultimately be more informed about what exists when they need those services. So the perspective of caregivers are really important and somewhat unique. So we've been we did a report on caregiving very early in the National Poll on Healthy Aging. It was one of our first reports looking specifically at dementia caregivers. But now it's something we're hoping to kind of integrate more closely into our work so that we can look at caregivers and their results on these different topics. It's something we haven't fully explored as much as we could, and so we'll that's something we will hope to do in the future.
Yeah, the only thing I would add to that is that, we also recognize that, yes, there are a number of issues related to caregiving. Some individuals may provide help to older adults, but may not identify themselves formally as a caregiver. So if you think about a neighbor or, a family friend or whatever the case may be. And so we recently released a report on that too. And it had, I think probably my favorite report title. It was Looking for the Helpers. If anybody gets the Mr. Rogers reference, I may be dating myself a bit on that one at this point, but I just, it really warmed my heart, that title, and that's exactly what that report focused on, was the support that's being provided to older adults, even if it's not formal caregiving. And we recognize that support is really, really common. It is critically important for many older adults. And so especially as we think about, well, what support can we provide to people who are providing, valuable support to older adults, but may not formally see themselves as caregivers? How can we keep that going, and how can we even build on that in our communities?
I have kind of a follow-up question on this topic. Do you have any questions that differentiates the caregivers who are also older adults?
Great question.
Yes.
Yeah.
Yes.
Yes.
We're able to, we have information about the age of all of our respondents, so we're able to look at that. We've over time asked our caregiving questions a little bit differently. So sometimes we ask if they're a caregiver of anyone, an adult or child, and then we ask, is it an adult or is it a child? So again, we know the age of the caregiver, and then have a sense of who is, what does that person that's receiving the care, are they, is it a younger adult with a disability? Is it an older adult? So we've asked that a little bit differently over time, but yes, we can look at, there are, of course, many older adults, 80s and beyond who are essential caregivers to loved ones. And then we know that there's also a lot of people in their 50s and 60s who are caring, potentially for their parents or neighbors or friends, in addition to potentially a spouse or partner, and also oftentimes children as well.
Representative, and then over here, and then we'll go back online for a couple.
Sure. Thank you for the presentation today. Really interesting. So I have a question about, folks as they age, seeking out like nutrition, education and services. And it's top of mind for me because like I'm in my 30s right now, but as I'm approaching the next decade in my life, I recently decided that I wanted to schedule an appointment with a nutritionist just to develop some better eating habits as I get older and all of that. And it took me over a month to navigate the system to be able to book an appointment with a nutritionist. I have health insurance, like I thought it would be easy. It was by far the most difficult medical appointment that I ever booked in my life. I was really struck by that. I have a lot of thoughts on that. I won't get into that, but I'm just curious for folks as they are aging, how are folks kind of setting themselves up for success? Are they seeking out, whether it's an appointment with a nutritionist or just education on that front to age as well as they can, I guess. Yeah.
Yeah, thank you for that question. I guess the short answer is to that is that it's not something we have addressed yet directly in the poll, but it's a great idea and something that we'll take back within our team. And again, we love to hear these ideas for poll topics. We feel somewhere between 4 and 5 different modules within each of the fieldings we do twice a year. So we're talking, 8 to 10 topics that we cover over the course of a year. So we're always looking for new ideas. We have most recently, probably closest to your question, we did do a report on what was called addictive eating. Okay, that's a good example of one unique thing we're able to do at University of Michigan, is we're able to draw on the expertise of the faculty of our university by way of the faculty at the Institute for Healthcare Policy and Innovation, which brings together over 700 people that do healthcare related research from across the university. So we have an expert in our Department of Psychology in our central campus that is a world expert in addictive eating, but we actually don't know much about what that looks like among older adults. Most of that work's been done looking at adolescents, younger adults, et cetera. And we found that people eating food with low nutritional value and having a hard time stopping doing so is too common among older adults, and there are a lot of supports that can be provided for that. Now, broader decisions about nutrition, it's a really great topic and something we'll absolutely take back to our team.
Absolutely. We've done reports that looked at food insecurity and just kind of access to food. We know that transportation can be a challenge for older adults, and there's other potential barriers. We also did a report that was looking at kind of cooking and, whether people were preparing their own meals, who people were eating with, were they eating alone? We know, oftentimes people, their family size kind of shrinks as they get older, so people may be less inclined to do the cooking that they once did. So we've looked at that from a few different angles, but it's something we will absolutely consider for the future as well.
Thank you.
Yeah.
Yeah, thank you so much. This is excellent information. It's very important right now. I'm a mental health therapist for community mental health through MNC in the older adult services department. So this is the population I work with daily or Monday through Friday, if you will. I'm curious about the questions, the 26 questions that you had in the poll. Did any of them approach any intersectionality of guardianship? Because the people with whom I work don't have a lot of caregivers. There's a lot of times, sadly, no one in their lives. And I've had it come up against, you know, that they have no other decision, and then now you have a guardian.
Do you recall, Erica, where that, we certainly had issues related to, you know, mental health and caregiving, and I know that's not caregiving, but you get the idea of, you know, how the supports that other people have, right, especially those who have unique physical and mental challenges.
I think we included advanced care planning, but we didn't have
Yeah.
anything on guardianship. One of the downsides to the poll is just that we need to have enough people in our sample who've had an experience. So sometimes people come to us, our experts within our Institute for Healthcare Policy and Innovation community, and they say, you know, we want to do a poll looking at a specific health condition, for example. And we find that the sample size just doesn't lend itself to being able to do that too fully. And the topic of guardianship is such an important one, and one where we could potentially think about how we could angle it such that we could ask questions that would involve the full sample about their perspectives related to it. But we sometimes find that we don't have, you know, we just wouldn't have the sample size that has had that experience in order to be able to dig too deeply into it. So it's a great question.
Gonna go to a couple online questions and then I'll come back. So because this one actually fits in pretty well. There was a question about response rate. And what is the response rate on this poll? Is it, you know, good, or is it something that's challenging for some of those subgroups?
Yeah, I can start on that. It's a really good question. Because one of the, you know, this work only matters insofar as we're able to use very rigorous methods to ensure that we are measuring what we think we're measuring and that these results are broadly generalizable, right? It's very easy to go out and just do a poll of people, ask a bunch of people a bunch of questions, see what you find, right? But are you really measuring what you think you're measuring? And is that more broadly generalizable where policymakers can actually take action on those findings? And so we think about that all the time. That's largely why we work with NORC out of the University of Chicago, is they have as good a reputation as anybody nationally in being able to field surveys and being able to look at these issues like Erica mentioned of, well, what about this subgroup? What about people who are not comfortable using technology? What about, you know, how do we enrich the sample to ensure that it reflects the diversity of the United States? And in this case, the diversity of our incredibly diverse state. And so those are things that are very important, and that's why we work with NORC there. Now, that being, we also work with them in part because they are very good at achieving high response rates. They know how to find people who are going to constitute a state and nationally representative sample, and they know how to get them to respond to surveys. Okay, so that's why we are so grateful for the support from the Michigan Health Endowment Fund and ARP and Michigan Medicine, because that is not cheap to do that. And so we really need the resources and the framework of the Michigan and National Polls on Healthy Aging to achieve a high response rate. Now, more directly, you know, if you talk to a survey methodologist, there are all kinds of different ways of defining that. You see this in the election polls now, right? You know, people can define a response rate in the way that they want to, right? In either direction. And so the way that we most commonly look at it is the completion rate. So among the people who are invited to participate in this particular survey, how many of them actually complete it? And in most cases, we have a completion rate that's greater than 60%. Most of the time, it's more like in the 70% plus range. Okay, so we're able to achieve very good response rates that I think are in general well respected across the broader social science research community. And that is just as important to us as getting the word out and making sure we're elevating the voices of older adults, is making sure that we're using rigorous methods.
And notably, what we have done over the past few waves of data collection is that we've tried to increase the diversity of our sample. We really want to make sure that to the extent possible, we're able to look at anything that we're seeing in terms of subgroup differences or notable findings by race, ethnicity, by other subgroup differences. And so increasing the diversity of the sample has ultimately resulted in a slightly lower completion rate, but it's something that we think brings a lot of strengths and rigor to the work that we do. So it's something, if you for our first Michigan poll, we found that the completion rate was about 40% among the probability based panel members that were selected to participate. And that's because we were really trying to enhance the diversity of our sample.
So then another quick one from online, with the areas agencies on aging and the SHIPs. What, during your poll process, how were those described? Is it possible that there's a disconnect that people knew their area on aging, but they didn't know that it was a area agency on aging generally?
It's a great question and very possible that that's the case. So we did ask, we couldn't ask about every individual organization by name. We have, I think, we have, more than a dozen here in our state, and there's hundreds nationally. But we did describe area agencies on aging, and in the case of SHIP, we did include the name here in Michigan, but we didn't do that nationally, again, because each state's SHIP, sometimes they go by a different name. So that's absolutely true. It would be hard to be able to get into that level of detail, and it's possible that there would be some name recognition for the local organizations that doesn't exist for area agencies on aging and SHIPs.
Yeah, and we think that maybe just really quickly, the other thing I would add to that is that, with these older adult advisors that Erica had mentioned, we think that could be a great opportunity to, when we're developing new survey questions in that way, again, make sure that we're measuring what we think we're measuring. What do you think of when you see this question? How would you respond to it? So that we can enhance our rigor even more. So we think that'll be a real opportunity, especially as we're developing these new measures, because nobody has asked these questions before. That's an important piece of the rigor.
So this is an observation and a question, being an older American, Michigander. Following up to your question, is the access to specialists here in Lansing area, it's a real issue. As she pointed out, I don't know if this was in the Lansing area, but seeing a nutritionist, my problem was seeing an endocrinologist. And I had to go to Livonia, that was 7 months in advance. And then, of course, part of that problem is because of diabetes, which brings in the nutritionist aspect. And that's probably why she had a difficulty finding a nutritionist, is because they're so busy dealing with diabetes issues. So in our area, it's a huge issue. In the neighbors I speak to, one was having a heart problem. She happened to know a friend who knew the doctor that got her in sooner. So then in the question part of your survey, I'm shocked that didn't come up as a topic, is access to specialists. So I didn't know if your survey questions were a choice that people selected from, or if it was just something that they could bring up on their own.
Yeah, I believe it. So we had both a list. It's a really good question, and that's an important topic that you raise. We had both a list of, kind of pre-specified categories. I believe that people could at least win our pre-test. So we pre-test all of our questions with a very small part of the sample, actually a couple months in advance before the final fielding of the poll. We look at our responses and we see if there's anything we should change. We often will then have a write-in section where people can write in ideas for things. And sometimes then we might form a new category there. I think that's also a good example of a challenge that we face in the poll, is that, there are, this issue of access to care is so important. And because of that, there are other national surveys that cover that topic. So for example, there's the National Health Interview Survey, there's the Behavioral Risk Factor Surveillance System. Some of the Census Bureau surveys actually get at that. For a national sample, the BRFS or BRFSS questions, those are state-specific ones that anybody working in public health will be familiar with those. And so we try to avoid things that we feel like are already well covered in other existing surveys, and then try to focus on what is our comparative advantage, where can we generate new data. Yeah.
The other thing that's notable about the format for how we listed those is that we were looking at the percentage you reported being very concerned for older adults in their community, and the graphic that Jeff shared was just the top 5. And the reality is that a lot of people are concerned about access to specialists. And I think it was one of the 26 items that we asked about. It just didn't fall at the very top of the list. If we looked at it another way, we asked people, are you very concerned, somewhat concerned, or not concerned? I'm sure there are lots of people who are very concerned, and many who are somewhat concerned about this as well. It's certainly not a problem that's unique to the Lansing area. And we recognize that to be a challenge for many people.
Yeah, and that's a good example of, being able to go on the dashboard that we have online through the, healthagentpoll.org/Michigan webpage, where you can play around with that and see how that concern stacks up to that of other concerns, and then how that may vary for different groups and across the state.
Thank you.
I think I got probably one more question coming in from Zoom that we can hit. And that is, thinking about healthcare institutions, what are they doing to train doctors and staff to be attentive to senior needs? And is that something that the polling has captured around anything on?
Yes, that is a really important topic. We're obviously at an academic medical center at the University of Michigan, and so we train a lot of future clinicians of all varieties, not just physicians, but nurses, pharmacists, people of all day, dietitians, people from mental health providers, all kinds of clinicians and future health professionals. And so ensuring that they're well positioned to provide expert care to older adults is critically important. Sometimes, one of the unique things we're able to do in our academic environment is we can engage trainees in those areas in the work of the poll. Often it helps them in their career development to work on, say, a peer-reviewed publication to submit to a journal. So oftentimes we will have, fellows, people who are in training. We might have doctoral students, postdoctoral fellows, who work with a faculty member on a paper using data from the poll. We've done that time and time and time again, and we hope that that will cause them to have more experience, more expertise, deeper reflection on issues that are critically important to older adults. And so we think that's a real opportunity. We've actually then been contacted by trainees from across the country who are interested in using our data. That's a unique challenge for us is, well, our faculty at our institution, how can they readily mentor you? I don't know. We're still trying to solve that problem, but it's a great problem to have because that means that the next generation is noticing what we're doing, interested in being a part of the solution for older adults, and want to develop skills in that area. So yeah, it's something we're continuing to think on and would love ideas about how to do better at.
We also do outreach to professional societies and, other organizations that are tapping into healthcare professionals so that they can understand the perspectives of older adults in a way that they might not otherwise be able to do.
Perfect. Again, another round of applause for our speaker today. I thank you all for coming. This is gonna be our last Wolverine Caucus before we go on a little bit of a summer break. We'll be back in Lansing in the fall. Thank you.
Thank you. Thank you all.
And for our in-person audience here, I do have some what we call buck slips, some flyers that include the QR code here. So let me pass those out for this session.
And happy to stick around if there are more questions we weren't able to get to.